Good day, dear listeners. Steve Preda here with the Management Blueprint podcast. And today's guest is Shane Foss, the founder and CEO of Hooray Health, a limited benefit medical plan provider. Hooray's goal is to offer low-cost, practical healthcare plans that are supported by technology and protect their members against predatory balanced billing practices. Welcome to the show, Shane. Great to have you.
Oh, thanks for having me, Steve. Look forward to it.
Well, lots of things to unpack in the introduction, which we will go to in a few minutes. But I'd like to start with how do you get to start a health insurance company? How does that even work?
You know, it's funny. This is not where I grew up professionally. I actually grew up in medical device sales, sales leadership.
Mm-hmm.
So in other words, really in orthopedics, my whole career has been really in the operating room and working with physicians and other healthcare professionals selling orthopedic implants. And so I've always been a very curious person, always a constant learner. And so, obviously I have an entrepreneurial bug. So what was interesting was I had left the orthopedic industry and with a very good friend of mine. And I got introduced as I was a COO of a company that created access for large self-funded employers for surgical bundles. And so we built that provider network out. And that was right up my alley because I understood that space really well. But really, as crazy as it sounds, I fell in love with it. It was really interesting. And what I found most interesting was that there was a huge opportunity that is interesting because, you think Darkside healthcare really, but providers in their Hippocratic oath, doctors and nurses, but a doctor in the Hippocratic oath, they take this oath and it's do no harm. And 99.9% of the physicians I know, that's what they live, that's their credo, they live by it. But what they don't realize is the ugly side or the dark side of healthcare is when you have bills that don't get paid for one reason or the other, whether your insurance didn't cover it, somebody, you billed an exorbitant amount that you didn't really, you as the physician didn't really know was happening. And then they can't pay it. So guess what? They get sent to collections. And, over 70% of personal bankruptcies are due to medical related bad debt. So we, that was really kind of my entry into that space. And so I understood it really well. And I myself, we sold the company and we stayed on 6 months, and then we went out and we're consulting, trying to figure out what we were going to do next. And so I had this idea of Hooray Health when I myself went into an urgent care and got an $800 balance bill. Mm-hmm. And so, understanding the market, I was able to negotiate it down. I knew, what it would take to get out of it. And so I took care of it. But, the average American, that's not what they do. And and it's just such a screwy market. And so I thought, what, this is a good opportunity for us. And so that was where I really got the foundation for Hooray Health and started building it from there. So really without the intent of saying, hey, I want to get into the health insurance space, it was more, really solving a problem for a group of people.
That's very interesting. And I've only been in this country for 10 years, but I also had an early experience with getting hit by a $5,000 bill for a 30-minute visit or something like that.
Right.
I was shocked and I fought the system. And I'm not going to get into it, but it was a long, hard fight. Eventually I prevailed, but I don't know if it was worth it. So it is a tricky thing, and we'll dive into a little bit frameworks and
sure
in different ways. So would you mind telling us a little bit about how that works?
Because I'm not making any money yet. I don't have a product. I don't have a sales distribution line. I don't have. So the evolution of your business, you have to have different skill sets, different organizational structure, financial structure, and KPIs or metrics, right, that you're measuring. And in the beginning, if you're measuring sales revenue or profitability, and you're just starting out, it's kind of ridiculous, right? I mean, that's why when you talk to investors and they're like, well, what's your where are you at profitability wise right now? What are you making? It's like, dude, we're growing so fast. We need more money. You know, we're growing, right? We're in the growth phase. So what we need money for is funding the growth phase. We don't want to make money right now. We want to continue to ride the wave. So yeah, so when you and I spoke earlier, it's you know, for when you're an entrepreneur, it's really being able to identify what phase you're in and then comfortably navigate through that. Because, so I'll give you an example. When we started the organization, we started off with a sales leader that his knowledge base was in really the individual and small group setting. And that was perfect for us because what it did was it gave us entry into that market where we were able to really use case, right? Understanding the data, understanding what we're doing, you know, the customer experience. And then as we transitioned into the next phase where we actually raised a lot of money and then we had to hire all the infrastructure, we did a complete 180. And now we went into the large broker setting, which is much more professional. You have to have a very good reputation to even get access into that space. And then our average employer size wasn't 5, it was, you know, 3,000, 4,000, 5,000 people, right? So it was a completely different mindset. And so not only did our metrics change, but really our capability. Most challenging parts of being an entrepreneur, you know, just being you're a CEO, even if you're not the entrepreneur, it's making those hard decisions and identifying them and then being real with what you're doing. So when I first started, it was really the pre-product phase. Mm-hmm. So the pre-product phase is really what I was measuring was, can I get the product built, the network, the insurance carriers. And so really success was measured through the number of contracted providers, the area, you know, the metro statistical areas we were able to cover and the scale we were able to create there and what providers. So then we went into the commercialization phase, which is really, or I'm sorry, not commercialization. We went pre-commercialization, which was with the testing phase. And so now I had to bring in financial support, right? Not a true CFO, but just financial support. We had to have marketing support. We had to have some operational IT support. And so we brought in a few employees to figure that out. And we brought in sales and distribution, which is, you know, who I spoke about earlier. So then the measurement was, okay, from a sales standpoint, what were the reactions? So how many requests for proposals were we getting? What was the close ratio? What was, you know, what were the key, eliminators, if you would? You really do need a financial partner. So we brought in a CFO to make sure you manage that because when you have investor money. But now the KPIs are, okay, what is our revenue growth? So before it was really just sales. Are we getting clients?
Mm-hmm. So new clients, new business sales.
Correct. And so now what we're looking at is revenue, retention, right? Renewal retention, employer and employee feedback. And so you're tracking all of the calls. How many calls are you getting per 1,000 people enrolled in your plan, stuff like that. And then once you get from there and you've proven the concept and you're going out, now it's evaluating what your real total addressable market is, mm-hmm. and what it's going to take to get there, raising that money. And then now your KPIs are group size, again, retention, participation rate, right? So how many people are actually enrolling in your plan, revenue per member, and then you're looking at profitability. Obviously, now we're looking at profitability. What does our margin look like per employee? But we're not looking. I shouldn't say profitability. It's margin per employee, because you know we're still outstripping our revenue just because we're growing so fast.
Mm-hmm. So you've got the The first phase was called pre-product, then pre-commercialization, then commercialization. And this last one is what, scaling? What do you call this?
Yeah, so now we're scaling. Yep. So yep, and then we're scaling. And then at that point, after the scaling, after we now kind of level out. So right now we're at that hockey stick.
I love that. That makes a lot of sense. Pre-product, you basically just want to get a foothold, you want to survive, whether you even have a product, right?
Exactly. You just that's your testing phase, right?
And then you scale this thing, and hopefully by that time you are self-financing. You don't need to bring in outside investors. You are generating cash. And then the maturity is when the business stabilizes, the growth stabilizes. It's kind of a very interesting one because you've got the big insurance companies on the one hand, and then you've got the medical providers, and then you've got companies like Aflac who are really basically trying to cover the lowest segment of the market for people who don't have coverage, don't have money for insurance. And you talk about limited benefit and unique benefit medical plans. So what are these plans and how they fit into the big picture?
Yeah, so where we fit, it's really interesting. So you've got Aflac. Aflac is really, they're actually an income replacement. That's what they focus on. What we focus on is affordable access to care for the population that either gets a plan for free on the exchange, and their employer, because so if I get a plan for free or a subsidized plan on the exchange today, I have a $5,000 deductible, right? Unless that's something catastrophic, it doesn't really matter. So that person can use our plan and get to the doctor, go to our network, pay $25 copay with no balance bill, do that. The other population that we serve is if you look at major medical today, the prices continue to rise. So the trend is participation is going down. 15 years ago, carriers had a mandate of 75% participation from an employer. Well, that's out the door. They don't get that participation anymore in most businesses. So if I opt out of that, now they could put us in as a supplemental health product to where that person can buy us at a much reduced rate. And we're what you call first dollar coverage. We're a fully insured product that has a limited medical hospital indemnity product and an accident medical expense that act as one, and they're combined. And what happens is we take care of sickness and illness. And if I had 14 stitches in my hand a couple of years ago, and I went into the emergency room, they stitched me up, and they billed the insurance company and our insurance company because I had no out-of-pocket costs because we don't have deductibles. This is how insurance was designed to be, right? This is what you had back in the 60s. And so it's a very commonplace product, but it's just now that we've had major medical and everybody expects, that's going to pay for everything. And then the reality is they don't pay for everything. We could pay up to the 5,000. We could pay more than the 5,000, depending on which policy you buy with us and what you're doing. The idea is that you would be able to use us to, let's say, to go to the first our network, which is the Hooray Health network. You'd be able to go in there and for a $25 copay with no balance bill, be seen by a doctor, get an injection, get a chest X-ray, whatever you're there for. And that's all you'd pay is $25.
Yeah.
And so it wouldn't go towards your deductible because it's not coordinating. But but the reality is the average American family spends less than $1,500 of their deductible a year.
So it's a replacement of a major medical, with the exception that there's no, if it's a major disaster, I get cancer, then there's limit to what you can reimburse, I guess.
Yeah. So we're not a replacement for major medical. I want to make that very clear. We're not major medical because we don't cover catastrophic. We are really there. We're what you call a supplemental health benefit. We sit directly under a major medical policy, or the reality is there's a lot of people out there that can't afford major medical. So yes, people do use us as their primary source.
health savings account to cover their deductible, and then they go with the major medical. But if they don't have it, then they could go with Hooray Health, and they would get coverage for the first 5,000, whatever, for first.
Well, the base, they would get their base.
They don't provide this kind of coverage because they want to sell the major medical insurance packages.
So some of them do. Some of them have supplemental health benefits for sure. But where ours is unique is we have the mobile app that shows you the network, shows you the benefits, it centralizes all the benefit function right on the palm of your hand. And then we have the only provider network in the nation that's a fixed global copay, no balance bill. And so what's really nice about that is millennials are really our target audience today, millennials and Gen Xers. And they expect to have a mobile app. That's just expected. But the other thing is they do not have primary care. So that's why we built the network the way we did. And the reason they do that is actually it's very smart, is urgent cares and retail clinics, they're open Friday, Saturday, Sunday. They, during the week, they're open till 9 o'clock at night, 8 o'clock at night. The level of care that you get there. So if I go to my primary care doctor with a broken ankle, they don't have an x-ray machine in their office. So they're going to tell me, why didn't you go to the urgent care? So millennials just skip that and they just go right to the urgent care.
Yeah.
From a provider standpoint for the delivery of care. And they're fantastic. We love them.
Awesome. So what are the balance billing practices, these predatory balance billing practices? What do you mean by that?
Yeah, so I'll just give you my own experience. So I had a $75 copay with one of the large health insurance carriers. I went in and I got my x-ray, and then I got my an injection, or 2 injections actually. So I was able to negotiate that down, and I just paid. People file bankruptcy. I mean, actually, it's over 60% of the population of personal bankruptcies are due to medical related bad debt. So the predatory practices are that even though that $800 balance bill, I paid less than $70 for that $800, and that's what's expected. That's how life really is. You pay $5 for it. I pay $5 for it. Maybe somebody has a coupon, but for the most part, we all pay the same price. Every insurance carrier or network has a different price as well. So nobody knows. I mean, as a matter of fact, the physician's office doesn't even know what they're going to charge for that gallon of milk. So what happens is you pay that $5 for the gallon of milk. You go home, and 3 weeks later, you get billed $50 for that gallon of milk, and you're legally obligated to pay for it, even though the grocery store never told you about it. The problem is the system is, I don't want to say perverse. It's, that's not the right word. It's the coordination in the system is so horrible that nobody knows what is really going on, right? It's so compartmentalized. You're thinking, oh my gosh, this doctor's sending me collections. No, he's not. He has no idea that he's sending you collections.
Maybe they are not sending you to collections. They just sell the receivable that they cannot collect, and then someone is going to collect. They have nothing to do with it. They just sold it, You
look at health systems, which are the worst of the predatory balance billing. And you look at the health systems, and they are nonprofit. They're not paying taxes, but yet they send more people to collections than any other business in the United States. So it's a challenge. And where my wife trained, she's a physician. University of Texas has a hospital, LBJ, just on the outskirts of town. They deliver more babies there than anyone else in the United States. And 99% of it's free. So I think saying that we don't have a safety net is actually not accurate, because we do have safety nets, and we've got Medicaid, we've got we as a country do take care of people. I think that there's a lot of stuff wrong, and but there's the reality is you can find care without going to an emergency room and getting that crazy bill. And And but the other part of it is, billing the middle class for, of course, I mean, that's exactly what's happening. I mean, that, look, if I'm only recovering, 20% of everything I bill at Starbucks, right? I'm Starbucks. Everybody else is gonna pay for it because I got to raise the price of the coffee from $3 to $5, right? I mean, that's the way it happens. That's just, basic economics. But the it's a really complex system, and there's a lot of great people that work in it. That just it is what it is. It's very challenging right now. Continued escalation of major medical costs going up. That's going to continue to drive people to the exchange and drive people to look for alternatives that where they're able to get their basic care. But really interesting things that are going to happen over the next 10 years that are going to really set the stage for something special.
I'm curious to see that, because a lot of people are actually not resigning, notwithstanding Great Resignation, because they have this conception that the big company pays our health insurance and it's so expensive, and if they didn't, then we would be out of luck. We would not be able to cover it. But if there is an alternative, or there are alternatives that a gig economy a worker can use, which are almost as good, then, and people wake up to that, then maybe a lot more dominoes are going to start to fall.
Yeah, I think so. I mean, there's alternatives out there right now. It's just it's just whether you're really out there looking or not.
Mm-hmm. Okay, well, fascinating topic. I think we could spend the next 3 hours going on rabbit holes in this topic. So if someone would like to learn more about Hooray Health, how you work, how they can access your products, maybe want to connect with you, where should they go?
Yeah, best place to connect with me is on LinkedIn or through our website at hoorayhealth.com, HOORAY health.com.
Awesome. Well, definitely check out Shane Foss on LinkedIn. Thank you, Shane, for coming on the show and explaining your lifecycle metrics framework, as well as how the health insurance system works and how you are kind of democratizing it with Hooray Health. And for those of you listeners, if you enjoyed the show, please don't forget to subscribe on YouTube and give us a review on iTunes, on Apple Podcast.